This is a brief overview of how you can implement this new strategy for your upcoming group medical renewals. By implementing a secondary health insurance plan on top of a self-funded minimum premium plan or a high-deductible health plan and adding a $0 copay TelADoc plan through EasyEnroll, you will have a three-pronged approach to saving your clients on their plan year after year. During this presentation, we will address two very important challenges in today's market: your need for bright, fresh new ideas on how to control the continual rise of health insurance premiums, and the soaring out-of-pocket expenses that employees and employers are struggling with. We will discuss how implementing a secondary health insurance plan can help your clients in three different ways. The first way is to lower the total out-of-pocket exposure for the employees by paying for things like deductibles, copays, and coinsurance. The second way is to select a more affordable health plan that has a higher out-of-pocket exposure. By combining a secondary insurance plan with a zero copay TelADoc plan, employees will have the assurance that their secondary benefits will provide a layer of protection for them. And if they would like a $0 copay for a TelADoc call, employees can avoid paying their doctor copay under the medical plan and have the experience from and keep the experience from the medical plan. Finally, implementing this type of plan pays benefits directly to physicians, outpatient facilities, and hospitals. This ensures that employees are not feeling the pressure of these costs as the secondary insurance and TelADoc plan pick them up for the employees. How do you lower your premiums while still recommending competitive benefits for your clients? If your client wants to maintain or pay less for insurance, the employees will almost always have higher out-of-pocket exposure. Employees are already struggling to keep up financially due to out-of-pocket medical expenses. Studies show that most HDHP plans do not have health savings accounts with them. Studies also show that staggering number of 62% of all personal bankruptcies are due to unpaid medical bills. A large majority of these people had health insurance in place, but still could not pay the bills associated with their deductible and their out-of-pocket maximums. These same studies show that people are going bankrupt over medical bills that were less than 10% of their pre-tax income. That means that an employee making $20,000 a year is having to file bankruptcy over a $2,000 medical bill. This is where secondary health insurance comes into play. Our benefits are structured to improve inpatient and outpatient coverage for covered expenses that track towards deductible and coinsurance. Each employee receives two separate buckets of benefits. The first bucket is inpatient, which covers expenses such as surgery, physician charges, and other charges that occur when admitted to the hospital. A good example of an expense such as this would be a standard baby delivery with 3 nights in the hospital. Your inpatient benefit would provide coverage to help with the bill in this example. The second bucket is the outpatient benefit. This includes coverage for services that occur in an outpatient facility: physician's office, diagnostic facility, urgent care, and emergency room. This is where most claims occur in a medical plan, and some common examples of covered expenses on an outpatient basis would be x-rays, blood tests, surgeries, and others. When designing your plan, you will have the flexibility to choose how much inpatient and outpatient benefit you would like to provide for your clients up to the maximum listed on this slide. It is worth noting that our claims data shows that 75% of all employees enrolled never spend more than $2,000 out of pocket in a calendar year. This seems to be where employees of your clients are hurting the most, and our plan is designed to help employees where they really need it. We can customize almost any dollar amount up to the maximums allowed with whatever medical plan of you and your clients choosing. So let's look at how this works. This past year, your client implemented a silver plan with a $3,000 deductible and 80% coinsurance. As you can see, the renewal premium for a single employee came up at $492. Your total cost on this on a monthly basis is $22,717. By recommending to your group to move to a self-funded minimum premium plan or a copay plan with a high deductible or an HDHP, you will reduce the premiums. Remember, under some self-funded plans, medical questionnaires may still be required for quoting purposes. In this example, we put in place a minimum premium plan with a $5,000 deductible with 60% coinsurance. Most carriers have a self-funded or minimum premium plan for small business these days. This plan has a much higher out-of-pocket exposure compared to the silver plan, but the premium is also significantly less. In this case, the single rate is only $299, and the total monthly premium for this medical plan for all employees is less than $15,500. Now, we come in with the secondary health insurance, which will help offset the higher deductible and coinsurance. You can see that the secondary premium is $85.35 for single and $4,392 for monthly for the whole entire group. Now, you don't need to do as rich of a plan as this one is, but this is just an example. In addition, with this secondary insurance plan, you can enroll a zero copay TelADoc plan for $4.50 per employee per month. Their entire family will have access to this TelADoc plan, even if not covered under the medical plan. When you add the monthly cost of this three-pronged strategy, the monthly cost for the entire group is $19,956. That is a savings of over $2,750 per year compared to their in-force silver plan, and will save this group over $33,000 annually. In addition, we haven't even calculated what the claims funding refunds would be on this group that has moved to a self-funded minimum premium plan. The fact that we've removed the claims exposure to the plan and pushed it into the secondary and the TelADoc will keep plans from hitting the medical plan via creating the reimbursement, the refund on the claims funding. With this plan, most employees have very little, if any, out-of-pocket cost, and those that do experience a slight out-of-pocket is a fair scenario. Those using the plan more should be paying a little more for their out-of-pocket. With the TelADoc plan, employees can avoid the doctor copays on the medical plan and speak to a doctor 24/7, day or night. This keeps employees out of the urgent care and ER for minor incidents. Now, let's compare the plan you are currently enrolling them or have them enrolled in to the strategy that we are recommending. If you look at your plan on the left, you will see that your client's employees must satisfy a $3,000 deductible before any benefits are paid for treatment, procedures, and tests. Things like office surgeries, labs, x-rays, MRIs, CAT scans, and hospital stays are all subject to deductible and coinsurance. Now look at the plan design on the right. This illustrates how the secondary plan works with the self-funded or higher deductible plan recommended. All of those things that we just mentioned, the surgeries, hospital stays, x-rays, are subject to deductible, but the employees will have the secondary plan benefit of $6,350 to help pay for those items. $6,350 for hospital inpatient expenses and $2,540 for any outpatient expenses. It is important to remember that once these benefits have been exhausted, the employees would be responsible for any out-of-pocket expenses left over. These benefit levels also work both on an in-network and out-of-network basis. This secondary insurance is a first dollar benefit, but should you wish to reduce the cost of the secondary plan, or If you're using a high deductible health plan with an HSA account, a deductible should and must be added. Now let's look at how this plan works for someone with common claims. If you look at an office visit where a diagnostic lab test and x-ray were performed, the bill would be $260, which would apply to the deductible. The outpatient benefit would pay this $260 directly to the physician's office, and the employee pays zero. Now let's look at the MRI performed at the imaging facility. This bill would normally be $800, which would again apply to the deductible. This is another example where the outpatient benefit would cover the entire $800 and the employee pays zero. Now, once you get to some of the larger claims, the secondary insurance may or may not cover the expenses at 100%. This is where your employees need to manage their own health care and search around for the best treatment options. In a typical outpatient surgery, the employee bill may be $4,000. The outpatient benefit would pay the first $2,540, leaving the employee with a balance of $1,460. Another example of this would be a baby delivery in the hospital. The employee bill would usually come in around $6,350, which is the maximum out of pocket on the medical plan. Our inpatient benefit would cover the first $6,350 on an inpatient basis, leaving the employee with a balance of zero. Now, once again, we don't need to make a plan this rich, but it is an option, and your clients would not be liable for any TelADoc tax under this scenario. It is important to remember that we are not providing employees with 100% coverage across the board. Our goal is to give benefits up front that will help with the higher deductible and coinsurance of any new plan. Employees who manage their benefits correctly will have little, if any, out-of-pocket exposure related to inpatient and outpatient expenses. Now the good part. In addition to earning your client's business and doing the right thing for your client, you just earned a raise in commissions. With the above example, you will see that even with a slight reduction in commissions on the medical plan for moving to a high deductible plan or a self-funded plan, with this new three-pronged strategy, you will make more in commissions than you did before. In addition to lowering their claims experience to their medical plan, giving richer benefits, as most employees may not see any out-of-pocket costs, and possibly getting a claims refund for their medical plan, you have made more in commissions. In this example, we're showing you that under the current scenario at a 5% commission, you are earning approximately $1,136 per month in commissions. With the new recommended plan, you would actually be earning about $1,525 per month in commissions, which is an increase. The claims process with secondary health insurance is not much different than what your clients are used to with their current primary coverage now. We issue a hard plastic ID card, and when employees visit the provider, they simply hand over 2 ID cards instead of 1. The providers will call and verify benefits, and once they realize they are getting paid for both, they usually are more than willing to send in the claim information and primary carrier information to our claims department, and payment is assigned directly to the provider. Once a year, employees must authorize the claims department to work with providers and pay claims on their behalf. It is a very simple process that works well when carried out correctly. We can have the employees actually fill out this once per year form at open enrollment time, or we can do it online via paper when they incur, or via paper when they incur the claim. The TPA administration is through Gilsbar and is top-notch in service, claims paying technology, and turnaround. With their back office administration, your clients will be completely satisfied with how this recommended plan works. In fact, they will like the secondary insurance plan more than the primary. And you, as their broker, will earn a level 12% commissions on the secondary insurance plan. Thank you for your time. Should you wish to get a quote for your particular client, please send in the RFP and information we need below. Thank you.